feed your gut. To be precise, feed the bacteria in your guts, because if you don't feed them, they will get their food by eating the mucus layer, which protects the lining of the colon and the small intestine. And very soon your gut will be a leaky gut. It will allow the toxins and bad stuff to go through the gut wall into the bloodstream, the portal circulation. And you see this very commonly in patients with liver cirrhosis. They will have something called SBP, spontaneous bacterial peritonitis, in which the junctions between the colonocyte, the desmosome, the tight junction, becomes not so tight, and the bacteria will translocate from the gut, the colon, into the portal circulation and cause ascites, the fluid in the tummy, to be full of bacteria, and we call this spontaneous bacterial peritonitis. That means there is no perforation, but the peritoneum is inflamed with bacteria translocation. Sometimes that can be endotoxin rather than true bacteria, but the way we diagnose, we do a neutrophil count on the ascitic fluid. And if the neutrophil count is more than 250, you have diagnosed SBP. Is an indication for liver transplant. Now, what I'm doing here, I've taken oak and I'm hitting this, is called flash cooking. So there's not much vegetable. So my code is there has to be three vegetables, three colors. Can you see the colors? So the three different colors, and I am going to flash fry. That means I'm just going to break the outer cell wall by flash frying, high heat. And the cooking oil I'm using, because you need to be master in oil, I'm using an avocado oil. Remember, the oil which is a seed oil, like mustard oil, like sesame oil, like sunflower oil, like corn oil, they're pro-inflammatory. In Indian cuisine, in Indian cooking, some of the recipes I don't have any choice, because if I do not use mustard oil, it is not going to be resembling that dish, because it is so exotic, and I will not want to change the recipe, like a shortse ilish, which is mustard. Ilish means hilsher. I have to use mustard, right? But other time I will use plant oil or non-seed oil, which is avocado oil, which is coconut oil, which is olive oil. Okay. Sometimes I will use butter, but however, butter you have to be slightly careful because of the calorie content. So now this is not very tasty, right? So I'm going to make it tasty. How? The frying itself is making it tasty, but then I'm going to put something in it. Wait. Here comes all the ABCD, ABCDs. So herbs, I will choose which one to give. I am going to give some tarragon. Without herbs, these will be tasteless, okay? Without spice, we need spice. It is oregano, okay? There is no cetul, what I'm going to give. And you know what? I'm going to make it even more spicy by giving some peri-peri. Now you can just have this stuff on itself. Even kids will like it. And if I have time, the smell now immediately changes to a more appetizing smell. And if I have got time, I can put some paneer, like a hard cheese. Hard cheese have got a, now I switch off the heat, so my cooking is done. Now, hard cheese has got some chemicals which protects your body from cancer, like feta cheese, paneer, halloumi, and all that. Coming back to the bacteria in the gut, you need to feed them, and this is tulsi. It's a very sacred, very holy plant in Indian culture. So apparently the air that comes touching this makes your house purified. Now this has got a lot of interesting chemicals in it. So Do you know what? I think this actually is not for us. It's for the gut bacteria, the good stuff, because gut bacteria is responsible for your happiness. It converts tryptophan to serotonin, the happy hormone. Every day you need a dose of dose to feel happy. So dose is D-O-S-E. D for dopamine, the molecule of more, which will push you to go out to achieve your dream. So it is not now here, it is there, out. Okay, molecule of more, dopamine. Then come oxytocin, that is the molecule of hugging, physical touch. Not just a quick, hi honey, how are you? You have to hug your honey tightly for at least 10 seconds, 15 seconds, longer. Maybe hug your honey and tell the whole story, what happened in the hospital today. Sometimes she will try to escape, but you have to have your oxytocin, right? Honey will also get oxytocin, but mental framing is important. If the honey doesn't want your hug, then that hug is not going to give oxytocin. Okay, so be careful. Don't be selfish. Second thing is D-O-S-E. S is for serotonin, the happy hormone. This is the molecule of now, molecule of contentment. So 70% of the time you should be in a serotonin phase, like I'm happy and now. This is called the green zone, like a yogi. You're content. You're happy with your kids and your family and your achievement and everything. But 30% of the time you have to be in the yellow zone. That's your dopamine zone. That's your epinephrine zone, which is energetic. You're going out, winning, conquering the world, changing the world, making the world a better place. Your dream, your writing, your film, your book, your whatever. You want to be chief exec of the trust and, lead physician, stop child labor, whatever is a big dream, small dream, whatever dream. That hasn't happened yet, but you're going to do it. You need dopamine and epinephrine. So D for dopamine, O for oxytocin, the hugging molecule, S for serotonin, the molecule of contentment, and E is epinephrine. I call this the molecule of charge, just go out, get it. So, coming back to the bacteria. Bacteria produces neurotransmitter serotonin. 70% of the happy hormone serotonin is in the gut. And if you don't have happy gut, if you don't keep these bacteria as happy, you don't feel happy. And all of our IBS patients will vouch that when they're stressed, the bowel symptoms plays up. And also, if the bowel symptoms plays up, they don't feel happy. So that's your serotonin. The gut bacteria does a lot of signaling between brain and the gut, and in fact it can tell your brain to eat certain kind of food. And there was an anecdotal story about a lady who was very slim runner who got C. diff infection, got metronidazole, nothing happened, got vancomycin, nothing happened. Then finally she had to resort to the last dreaded treatment for C. diff diarrhea, which is FMT, fecal microbiota transplant, basically eating poop. Not really, but yeah, you basically take the bacteria from a poop and put it in the colon from the back end. Yeah. So within 2 years, that slim running lady became very obese, put on some, can't remember, 20 pounds or so. And then she was thinking, what's happening? The doctors were thinking, what's happening? Her food choices completely changed. She's now craving cookies and stuff. Guess what? The poop came from her niece. And the niece is super obese with a BMI of 39. So your bacteria can make you crave certain food. Now this is early science. We don't know how it does that. So if you want to get rid of all those bacteria, just give yourself a bowel detox. I come from India, the land of Ayurveda. Veda is knowledge. And Ayur means life. So about life knowledge. In all those ancient thousands years ago, Indian philosophers kind of somehow concluded that these are good stuff, not knowing anything about a microbiome or anything. Anyway, and this is something I've never used before. What is this? Pectin. Pectin is something these are called prebiotic. So we all know about probiotic. Now probiotic is live bacteria like kefir, like lassi, like yogurt, like kombucha, like what is the other one? Kimchi. These are all fermented food. But the thing is, we all get this probiotic when you're born from our mother. When you're passing through the vaginal canal, we get smeared with the vaginal secretion and a poopy secretion, and that's our first dose of probiotic. We don't have to buy probiotic, but the problem is that we have to, because our intestine has become so unhospitable for this bacteria. Every day we have to replenish. Rather than that, should you not make the colon be more hospitable for these bugs by feeding them so that they don't have to rely on eating our mucus layer and damaging the lining? So this is prebiotic, food for bacteria, food for your thought. Enjoy, and don't ask me what I'm doing with this. This is the new thing I'm trying, cappuccino. Cocoa powder, cacao powder is very good for immune health as well, but not the sugary bit, the bitter bit. I'm a nutrition, I'm so much, how to heal body, how to get energy just by playing with your food. And that's what you need to learn. Doctors, nurses, all healthcare professionals. If you don't know your nutrition, you are not a good healthcare professional. You cannot advise. You don't have the right to advise patients because you are not following it yourself. Anyway, learn. There is still time. Come to me. Take sabbatical. Now I will teach you.